Welcome everyone. I am Sambardhan Dabadi, Biomedical Engineer from Annapurna Neurological Institute and Allied Sciences. Today, I will be presenting on the topic EEG in awake state. As we have discussed earlier, the EEG is the recording of the electrical activity of the brain recorded through the scalp. The sum of potential difference between two electrodes plotted over time creates an EEG signal. Such signal can be differential or bipolar recording based on the montages that we have used. The EEG waveform ranges from 0.1 Hz to 100 Hz. Such waveforms can be classified as alpha, beta, delta, theta, and gamma based on their frequency ranges. Talking about the morphology of the EEG, the shape of the EEG signals can be monomorphic, that consist of single distinct kind of EEG activity, polymorphic, that consist of multiple shapes and multiple frequencies that combine to form a complex waveform, sinusoidal waves that resembles the sine wave, and the transient wave that are distinctly different from the background activity of the normal EEG signal, that can be spikes or the sharp waves, commonly called as the epileptic discharges or the abnormal EEG waves. The frequency of the EEG wave can be rhythmic, arrhythmic, or dysrhythmia. The rhythmic signal consists of similar kind of EEG pattern repeated over time. The arrhythmic signal consists of no stable rhythms, and the dysrhythmia are the arrhythmic signals that are usually present in patient groups and are rarely seen in healthy subjects. The voltage or the amplitude of the EEG signal defines the peak of the waves. The peak of the wave depends on the acquisition technique and setting used. Such peaks can be attenuated waves. They are the reduction of the amplitude of the EEG activity resulting from blockage of signal from any part of the brain. Hypersynchrony. Such hypersynchrony is increase in voltage of the amplitude due to the rhythmic activity, and this also implies that there is an increase in number of neural elements contributing to the rhythm. The third one is the paroxysmal signals. The paroxysmal signals are the signal that usually reaches a high voltage and abruptly goes down to a lower voltage activity. Though such signals do not directly imply to the abnormality, much abnormal activities are paroxysmals. So talking about different brain waves, the first one is alpha waves. This ranges from 8 Hz to 13 Hz and have a voltage less than 50 microvolt. Alpha waves are usually acquired during awake state, physically and mentally relaxed with eyes closed. Looking at the morphology, the alpha waves are rounded or sinusoidal in nature, and they usually appear from posterior occipital, parietal, and the posterior temporal part of the brain. Here we can see the waves ranging from 8 to 13 Hz with sinusoidal or rounded waveform like patterns. These waves are acquired during mentally relaxed and eyes closed state. The second kind of brainwaves are beta waves. They are higher in frequency ranging from 15 to 30 Hz but lower in amplitude. Such signals are acquired when the patient is mentally active and alert. Morphologically, such signals are pointed in nature and they appear from frontal and the parietal region of the brain. Here we can see the high frequency pointed waveforms consisting of beta waves. The third waveform is theta wave. They range from 4 to 8 Hz and have a voltage less than 15 microvolt. Such waveform appear during the state of sleep or the drowsy state. Such waveforms are normal in children below 13 years, and they appear from frontal or the central region in children, and in adolescents they appear from the anterior region, but in adults they are diffused in nature. Here we can see low frequency, low amplitude signals with rounded or sinusoidal appearance. Signal wave is a delta wave. They are the lowest frequency waves appearing from the brain and have a frequency less than 3 Hz. They have usually high amplitude and appear in the state of deep sleep. Such waves are normal in infants below 1 year, and morphologically they appear rounded or sinusoidal, and They appear from frontal lobe in adult and occipital lobe in children. Here in the figure, we can see low frequency, high amplitude rounded signals which comprises of the delta waves. Eye movement in EEG causes the changes in EEG signal. Generally, the closest of the electrode experiences the changes in amplitude and the deflection. The changes in eye movement can be of three types as shown in figure. Here in the figure, the spikes in the frontal and the frontal parietal electrode are due to the movement or the opening or the closing of the eye. In the video, we can see the deflection of the electrodes related to FP, frontoparietal region of the brain. Such deflection in the waves are due to the opening and the closing of the eye. Photic stimulation is done in a regular EEG, such provide an external stimulation of electrical flashes. The flashes ranges from 1 Hz to 35 Hz. Such flashes are performed to detect epileptic sensitivity to flickering of light. This light or the lamp is used to produce the flickering lights and they are directed towards the patient's face. Such photic stimulation causes spikes in EEG and are observed as PS recording. Here in the video, we can see the stimulation of PS from 2 Hz and the stimulation is gradually increased to higher frequency. As the frequency increases, we can see spikes in EEG waves. These are due to the stimulation of the eye and the retina. The lines here show the frequency of the photic stimulation. Another routinely performed EEG parameter is hyperventilation. Hyperventilation is usually performed to deliberately cause the slowing of physiological EEG waves. Hyperventilation provokes internal discharges and seizures, especially in generalized idiopathic epilepsy. So, hyperventilation in patients with epilepsies helps to provoke the epileptic discharges during routine EEG. Here in the figure, we can see the recording with hyperventilation. For hyperventilation recording, we can use the option of HV in EEG recording software. So these are my references for the presentation. Thank you for your attention.